This segment is sponsored in part by One Brooklyn Health.
Welcome back. May is Trauma Awareness Month, and maybe you're not aware of this because I was not. Were you?
No.
But trauma is a leading cause of death for people under 45 years old.
Yeah, from car accidents to serious falls, there are many ways to keep yourself safer. Dr. Ramy Abdel-Naby, and the trauma medical director, and Dr. Eimon Lee, the co-director of the surgical ICU for One Brooklyn Health, are here to tell us more. Welcome to New York Living.
Thank you for having us.
Thank you guys for being here. Very important and serious month. Just starting off, Dr. Abdel-Naby, before we talk about prevention, can you tell us about how serious of a health problem trauma is?
Absolutely.
Because that was alarming, what we said in the open.
Absolutely, yeah. Trauma is a very broad topic, and what people don't often realize, or what we don't talk enough about, is that not only do you have physical injury, but you also have mental trauma, you have emotional trauma, and all of these actually work together to affect someone's life. And so for us, it's important for us to not only treat the injured, but address these other issues within trauma and, as well. The other thing to understand is that not only is it the leading cause of death amongst young people, but it is the fourth leading cause of death for all comers, right? Which follows actually heart disease, cancer, COVID-19, and then you have trauma. And then when you look even closer, traumatic brain injuries, or TBIs, actually cause for over 70,000 deaths a year, according to the latest CDC data. And it also causes 200,000 hospitalizations in the US. And we're not even talking about disabilities and the number of disabilities, the life that people have to live with traumatic brain injury, which is also quite staggering.
It is, and I think the vast majority of people who have heard of TBI, at least I, associate it with football injuries.
Right.
And Dr. Lee, I wonder if you could set the record straight. What exactly is TBI?
So TBI, or traumatic brain injury, is a contusion or bruising on the brain, bleeding in the brain, that can happen from any hit, any blow to the head. So this can happen in a fall, a car crash, or assault. So a devastating traumatic brain injury can also happen from a penetrating mechanism like a gunshot to the head. Violence is actually the third most common reason we have trauma, or we have trauma within our system, whereas number two would be related to motor vehicles. So a collision between a car and a car versus a bicycle or an e-scooter, a car versus a pedestrian. All those can cause traumatic brain injuries. And the most common cause of trauma we see within One Brooklyn Health is elderly people falling. And you know, even a fall from standing height can lead to a traumatic brain injury, as well as hip fractures. Both are common. So, but these problems aren't unique. Our community deals with the same problems that every community deals with, and that is we all have an elderly population that needs increasing care and attention, and we need to improve our road safety.
Now, what, Dr. Lee, are some steps that folks can take to make sure that they are keeping themselves safer to begin with?
So since fall is the #1 leading cause of injuries, emergency room visits and hospitalizations for older adults, like 75 and older, we try to educate that particular population about simple things they can do to prevent that fall in the first place. So wear proper shoes inside and outside the house. Avoid things on the floor that you can trip and slip on, clutter, even rugs. Put lights and handrails in staircases in your house. If you're walking outside, pay attention to cracks in the floor, uneven pavements, and get your eyes checked yearly if you can by your eye doctor.
And don't be afraid to use a cane. My 87-year-old
Yeah,
mother,
that's
it took
for
a
you.
while. It took a while, but now she doesn't go from point A to point B without it.
You know, that's for older adults, but on the other hand, when we look at the younger population, especially ages 15 to 24, they get hospitalized or get the traumatic brain injuries more commonly in motor vehicle crashes. So we like to reinforce the following. Again, things that you've heard of over and over again. Wear a helmet. If you're riding a bicycle, e-scooter, wear your seatbelt. Always.
Things that are so common practice but easy to forget in the moment. Before we go, what is One Brooklyn Health doing to promote better outcomes for trauma patients.
Absolutely. One Brooklyn Health, Brookdale Hospital has made a serious investment, not only in our trauma team, but the infrastructure within the hospital itself to provide better care for the hospital. So for example, over the last few years, we've hired a team of 8 trauma surgeons that are incredibly talented and well-trained from institutions across the country. So our community can rest assured that they're getting the same standard of care that they would get if they showed up to any other trauma hospital across the country. The second thing is that we have 2 neurocritical care intensivists to deal with TBI patients.
Yeah.
Those individuals are incredibly talented and well-trained, and we're lucky to have them. There's also investment into the infrastructure of the building. So we have a new state-of-the-art ICU that was opened up a few years ago, and we're currently undergoing a brand new reconstruction for a brand new emergency room.
What are you not doing
Exactly.
at
And
One
so
Brooklyn Health?
really what we're trying to do is not only provide better care for our patients, but also increase and improve the standards of care that our community members deserve and should be getting.
Amen. Doctors, thank you both so much for being here and spreading this wonderful knowledge during Trauma Awareness Month. And don't forget, you can scan the QR code on your screen to learn more about One Brooklyn Health's emergency services and get information on avoiding a trip to the ER.
That's right.